enter the room.
Hi.
My name is Dr. Varghese. I'm one of the doctors in the GPA department. Am I speaking to Victoria Bennett?
Yep, I'm Victoria.
All right. How would you like me to address you?
Victoria's fine.
All right. Very nice to meet you, Victoria. And could you confirm your age for me?
I'm 15.
All right, Victoria. So let me know, how can I help you?
I'm not really sure, doctor. It's a little, embarrassing to talk about.
Oh, I can see that you're a bit embarrassed, Victoria. Rest assured that we are all medical professionals here, and you don't have anything to be embarrassed here. And whatever you tell us will be, everything is confidential. So we have that reassurance from our side. So, and we have seen a lot of cases that you might consider as embarrassing. So just shoot out whatever you want to tell. I'm here to help you.
Oh, yeah, I'm sure. You see, I've been experiencing this swelling in my private area.
Okay, all right, I understand. And could you tell me since when you have been experiencing this swelling for?
It's been like about a week now.
Okay, I understand. And do you have any kind of pain over there?
No,
Okay, and you mentioned swelling. And is it getting bigger, the swelling, or is it getting any kind of, is it staying the same?
I mean, there are multiple of those. So some are getting bigger, some are small.
Okay, and anything else that's concerning you apart from the swelling that you mentioned?
No, I'm a little worried. It's a little embarrassing, right?
Okay,
So,
I understand your concern, Victoria. Sometimes when something happened to us there, it can present to us in an embarrassing way. But rest assured, I'm here to help you with this regard. So, and don't be embarrassed of talking of anything. So, again, all right. So, could you tell me if you have any kind of discharge coming from there, or have you noticed anything unusual?
no, not really. It itches, sometimes, yeah.
Okay, so how would you tell, is this itchiness is accompanied by the swelling every time?
Yeah,
It becomes.
it's at the swelling that I feel itchy. But
Okay,
yeah,
and is it getting any worse? Is it getting worse?
yeah, I mean there are more of these bumps coming up, so wherever they come up it's a little itchy.
Oh, I understand you. And do you have any kind of specific times that this itchiness is more that your experience?
No, not really.
Okay, that's good to know. So I'd like to ask a few questions about your past history and your medical life. Is that all right?
Yeah, sure.
All right. So Victoria, could you tell me if you had any kind of symptoms as such in the past?
No, this is the first time.
Okay, got it. And do you have any kind of medical history of lung diseases, diabetes, anything?
No, doctor.
Okay, and do you have any kind of allergies?
No, doctor, not that I know of.
Any medications that you take?
No.
All right. So Victoria, I'd like to ask a few including questions, if that's all right with your sexuality. Okay, is that all right?
Yeah, okay.
All right. Are you sexually active?
Yeah, I am.
Okay. And could you tell me how long you have been sexually active for?
Say like about a month. I mean,
Okay.
no, 8 months.
All right. That's good. That's fine. That's fine. And do you have a stable partner?
Yeah, it's my first.
All right. That's good to know. That's good. And how do you feel? Do you feel well in the relationship?
Yeah,
Yeah.
I like the relationship, yeah.
Oh, that's good to know. That's good to know. And can you tell me how old your partner is? Is that all right?
Yeah, he's, I'd say around 35.
All right. Okay. And could you tell me since when you have seen, like, when did you meet this person?
Oh, he's actually my teacher in school.
Okay. All right. And since when have you known this for 8 months, you mentioned?
I mean, 8 months we, started being in a
All right.
relationship.
Mhm.
Yeah, he's been my teacher for like a year, I would say.
Okay, and how is he with you in general? Is he, how would you characterize him? Is he
He's
good?
very nice. Yeah, he's very nice.
All right, and do you usually have protected sex, or do you have safe in general way?
We don't use protection. I mean, he likes it that way.
Okay, and have you, does he have any other relationships or any partners that you are aware of?
No, no, I haven't really asked him all that. I mean, I'm enjoying
Okay,
my life.
all right, I got you. And does he have any kind of symptom similar to you, some kind of itchiness or anything that he mentioned
Two
lately?
minutes remaining.
No, not really. I'm embarrassed to talk to him also about it.
Okay, okay. And I'd like to ask you about your periods, Victoria. How long have you been, is your periods regular?
Yeah, it's regular.
Okay, and do you have any kind of bleeding, heavy bleeding?
No, no problem. I mean, it's been great.
All right. So, do you have any idea what might be causing this, Victoria?
No, I'm not sure.
Okay, and any concerns apart from the itchiness and swelling that you mentioned?
No, mainly that I don't want them anymore. I want to get rid of them.
I will help you with that definitely. And do you have any kind of thoughts how we could help you with that? What do you expect? Anything in particular?
Yeah, I just want to make sure that it's gone. I mean, if there was a way to remove them.
Definitely. So, Victoria, I'd like to do some tests, okay, before I could give you something to help with the problems that you're having. So, I'd like to examine your body, your physical examine general state, all right, and as well as to get your blood pressure, your heart, as well as to check down there. Is that all right?
Yeah.
All right. So, Victoria, thank you for letting me examine you. So, from my examination, I'm seeing that when I examined you down there, I see that you have mentioned some swelling. So, as well as you have mentioned that you have some itchiness, as well as some pain. Um, so, I
No, I.
think, okay, you mentioned itchiness. So, I think you
Hmm.
have contracted some form of sexually transmitted disease, Victoria. Have you heard of these things before?
I mean, I've heard of an STI. I mean, is
Mm.
that how it looks like? How? Okay.
Yeah. Okay. Yeah. So it's this is
Next station.
Thank you very much. That was a good attempt. I
I
know this
think
is a difficult
it's
stage.
yeah, yeah. I mean, it's complicated as it's the case of minor, and at the same time you have to treat the case. My history was too prolongated. I should have been a bit more fast. But
Yeah, yeah. You should have. I mean, as soon as you identify, so in the beginning itself, you identified that it's a, the two questions I would say for any private swellings, like swellings in the private parts, is number and pain. With that you can get most of your diagnosis of an STI. So there is a single painful, single painful as chancroids, or painless is syphilis, multiple painful is herpes, and multiple painless is warts. So now you know it's that. So as soon as you see that it's a 15-year-old come with a STI, then you know what all questions you have to ask, right?
okay,
So
all right.
this is going to be a different sort of a station. This is not a simple history taking station. It's not a pediatric station. So you
Mm-hmm.
need to start asking those questions immediately. Like you were investigating a little bit more into my private life. I mean, my past medical history and all that. Quickly ask that, like just one or two questions, and just move to
Okay.
the important questions, right?
Okay. To
I
go
mean,
more faster in the history.
yeah,
Sorry.
because these are you were headed the right direction. So these are
Mm-hmm.
those scenarios where you have a lot to talk about, especially in management. So you,
Mm-hmm.
as
Yeah.
soon as you understand the issue, move on. Like don't try to ask more questions on the facts that you've already understood, because there are
Okay.
so many things to reach, especially when you go to management. So you understood that this was an illegal relationship with a person in a position of power,
Mm-hmm.
and kind of form of abuse and she has STI. That all you managed to gather. That's what. No, now you have to bring it back to management.
Yeah, bring it
How
back.
to manage understand that like way before itself you were able to understand that, right?
Yeah, it was easy to understand. Then I should have already started my examination a
Started
bit.
right, exactly. But good job. Now the examiner will take over.
Okay.
Hello, hi,
Hello,
Evan.
hi. Thanks. Hello, nice to meet you.
Adam. But yeah, like you said, so what do you think is the key issue over here in this case?
I feel like I always have trouble in the case of data gathering that is too prolonged, and I somehow end up asking irrelevant questions, and I end up in the 2 minutes somehow in the management somehow. If it's even the case, in the case here, I didn't even cover the management, and I have really trouble moving on to the management. I'm getting stuck in one place over and over.
Yeah, absolutely right. You know what the issue is, but that's not what I'm asking. What is the key issue in this particular case? What are you expected to manage? So let's say you have only one sentence that you can tell her, one thing that you want to tell her before she leaves. What is that thing?
Probably social security.
Exactly. You didn't even bring that up at all. See, the genital watch is nothing over here compared to the main issue, which is the abuse that she is in a sexually abusive relationship.
Okay. So in this case, we have to first start with the abuse itself. Like you have to mention that you are in a bit of a relationship with a person that is older than you, and then
Yeah.
you start with the other
Yeah,
part.
I'll explain. So what I'll do is I'll go point wise. It will be
Okay.
much
All right.
easier.
All right. All
So
right.
if you see data gathering, you mainly. Oh, sorry. Yeah. So if you see the data gathering points, you've covered most of them, but these are all important points. But there's two more important points here that you didn't ask.
Oh, okay.
Age gap.
Expert. Mm-hmm.
As soon as you realize there is a significant age gap,
Mm-hmm.
you just ignored that. You just moved on. So what you should
Yeah.
yeah what you should instead do is ask her, has anybody else mentioned that there is a problem with the age gap?
Okay. All right. So
If,
why I moved on my thinking process was, not to scare her or like to not to judge to be judgmental or something because she was quite open.
that's not being judgmental. You're still data gathering, right? What is the best way to ask that question is, what about your parents? Do they know, like, or do
Uh-huh.
your friends know that you're in this relationship? So
Okay.
is it something that she's maintaining secretly, or that people already know about? That's something that you can ask her, because that is something that can help you, right, later
Yeah, yeah, yeah,
in
of
your.
course, to bring it back. Yeah.
Yeah.
So I
So
I, I could mention like is this I see that there is a bit of difference in your ages. Can I really tell like that the age is a bit different? Like there's a big difference between yeah.
definitely bring that up. Should
Okay.
definitely express the concern about the age difference and ask if anybody else has already asked her about that. But you're
Okay.
asking that because you're already telling her that this is what I think is more important than your problem here, right? You're already
Okay. Okay.
planting the seed in her head. So you don't have to wait till management, because you have so many more questions to ask in data gathering, because you have to know if she's being forced. You have to know if she is in with someone who is in a power, position of power.
Okay.
You
All right.
have to know. Yeah, you also have to know if there is anything else going on in the thing, like is she being forcefully in the relationship. So there are a few more questions you have to ask her. So it's not just sexual abuse, there's physical abuse, there is emotional abuse, there is like, is
Okay.
he blackmailing her? So there's a lot of things you have to ask her, so you can't just move on, you leave data gathering without asking these important questions, right? So
Okay.
always try to identify what is the key issue that is happening in this. So I've given you a tick in issues here. That's very, very important. If you any case, try to understand what are they trying to assess me on in this particular case. That is something when you're reading itself, if you can identify that. See, you saw that it's a 15-year-old girl, and you saw that she has some embarrassing problem. She didn't tell you what problem it is in the question. It's not there. She didn't tell the So she booked an appointment with the GP. Normally when you book an appointment with the GP, you tell the receptionist what your problem is, right? You tell them if you
Okay.
have chest pain, you tell them if you have headache. But she has not told that. She said there's some concern. That itself will give you a clue about, okay, this could be some embarrassing problem. Because that's all you have. You have 1.5 minutes there to think about. What else can you think about? You can try to think about all these things. So this she is a female, she is young, and she has some embarrassing problem. That itself will give you some clue, right? Before you go in
Okay.
itself.
All right.
Then uh, then you asked about the P questions, but before that you wasted too much time data gathering, so you didn't really have much time for these questions. But yeah, these are also important. So what you could have done instead of asking about the Odipara, the expanding the presenting complaint, is
Mm-hmm.
you go into these main key issue data gathering mainly. So initially you realize, okay, it's a swelling, it's a mass where in the genital. That itself is already enough for you to think that it could be an STI. So you quickly
Okay.
ask the questions, and immediately you have a diagnosis already, genital warts at that point. So then
Okay.
immediately ask about sexual history, because that is the next important question, right? So
Oh,
once you have, go on to the management. Okay, then in you so if you see, you missed everything in management. You could
yeah,
only
of
give
course.
the diagnosis, but
Yeah.
next. So you heard the 2-minute bell, and you were still data gathering. Did you realize that?
Yeah, I heard the bill, but I didn't want to panic. Or if I panicked, I was like, I will be completely ruining my flow, and I didn't know how
Oh,
to transition to the management already.
absolutely. That's absolutely right. You should not panic, but the 2-minute bell is there for a reason. That's not something you should ever ignore, right?
Okay.
Because already taken up 6 minutes of your time, of your total 8 minutes time, and you're still data
Mhm.
gathering. You have management which is equal in marks to data gathering, right? So
Yeah.
that's why they're telling you that there is 2 minutes remaining. Wrap up your consultation. You move on to management. So next time, whatever station you are in, whenever
Mhm.
you hear the 2-minute bell, you have to keep this in mind. You have to realize you have whatever data you gathered is enough. Move on to management. Give whatever management what are the things that you'll always give in management in any station? Safety
Uh,
netting
uh, all right.
and
Leaflet,
pamphlet.
follow up.
So these three things, just blurt it out. As soon as you hear the bell, whatever sentence you are in, just think about, okay, how do I bring this sentence to safety netting now? So
Okay.
you are explaining, I'm giving the diagnosis at this point. 2 minutes bell rang. Okay, so I'll talk to you about the management, what we can do for it. But before we might not have enough time, so I just want to tell you some warning signs to look out for. And I also feel that I need to talk to you about this relationship that you're in, because I feel that is something that needs to be brought up. So you can say that before you even bring up the management for the wards, because there also you're telling her, okay, this is you're telling her, and you're telling the examiner also that you understood what the key theme here is, right?
Okay. 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 Somehow try to understood what your point, like to bring it slowly, but at the same time, if you are short in time, somehow push that in the front line.
Exactly. Always try to bring up safety netting, follow up leaflets and pamphlets, because these three will save you. You will get 2 or 3 marks in management if you just manage to do these correctly. These three things.
Okay. All right. All right. I really understand that now.
Because it's nicely covering everything. So you say follow up. Follow up is, yeah, who is she gonna follow up with? She can't leave right now, right? You can't send her
Mhm.
home. You know that you
Yeah.
have
She
to
has
bring in.
to.
So when you think of follow up, that will come into your mind. You'll tell that immediately. Okay, I noticed that I will have to bring in my senior. because this is an unlawful relationship that you're in. And trust me, it's not your fault. This is something that your partner should have known. And if we don't do anything about it, he will get into major legal consequences. And that is the exact only reason that we are doing this. It's nothing against you. All right, something like that. You just show the key issues that you found in the consultation.
All right.
Then always involve senior. This is not something that you can handle yourself. This is a case you can never handle yourself. You have to
Okay.
involve a senior. So that is something you have to mention. And
Mm-hmm.
offer a referral to the gum clinic. This is all the so management about the uh, genital warts. So how do
Genital
you
warts.
exactly. So what you have to tell is you just reassure her. So this is a self-limiting condition, but there are treatment options available, and I can put you in touch with a specialist if you want, or we can treat you here if you're comfortable. All right,
Okay.
and tell her that you have to make sure to follow protected sex, like safe sex from now on. That is one important safety netting that you have to give, because it's already happened. You know that the treatment, she is already sexually active, so you have to make sure that she is practicing safe sex, because that's
Okay.
not something right, that's not something you have any control over. Then and HPV. So in the P questions, normally if it was an elderly, like more than 21 years old, is when you usually ask about the pap smear. But anyone who is sexually active has to undergo pap smear, right? That is something that you have to tell her. There's so many things in management, right? In this case,
So pap smears between 25 to the age is from 25, right? So she's 15. So do we have to give her pap
why
smear at the moment?
exactly? So why do we do pap smear?
It's for cervical
To
risk
check
of she has cervical like genital wart, so she already has the risk of developing
exactly
cancer.
anyone who is sexually active is at a risk of developing HPV infection and ultimately cervical cancer, right? So
I got
every
that.
sexually active has to undergo pap smear. Then after there are so many things in management you have to bring up, but always try to think, prioritize what you have to bring in first. So there's no way you can bring in all these things. So make
Okay.
sure that, so that's exactly what they're looking for. How would you manage your time when you have so many things to tell? So always prioritize the most important point here is that she is in a abusive relationship, and that
Mhm.
she has to you have to involve a senior. If you just mention senior, you'll happily pass the station, just for management.
Just to
that,
manage.
that is they're looking for whether you will actually involve your seniors, or you'll just take your decision on your own and send her home. So
Okay.
if you do done, then that is fine. And then leaflets and pamphlets, always any station, don't forget leaflets and pamphlets. That's one easy point that you
Yeah.
easily
Okay.
get. Then the interpersonal skills. So it was really good how you managed, but the main things that you're missing in interpersonal skills is reassure and support, offer to tell the parents and carers, because she's still alone at this point.
Okay.
She'll just
Uh-huh.
be the only one who is supporting her. You don't even know that. So you have to ask, what is her support structure, where is she going
Where
to
she
go
living?
if you send her
And who
home.
does she live with? Who does she live with and all?
Exactly. So where,
Okay.
it's not just who does she live with, who is do they support her, who she lives with.
Uh-huh.
That's
Support
also
itself.
mm. And confidentiality. That is, I mean, it depends. If she's specifically very you did that really well in the beginning when she said I'm embarrassed. You brought her to open up. That's really good. But yeah, you need to keep practicing. You have to develop an internal clock in your head that
Uh-huh.
you can't be panicked by the 2 minute bell. You need to know when the 2 minute bell coming before it comes itself, right? That will only come with practice.
It only comes with practice. Okay.
Exactly. You have to continuously practice. Just you'll automatically, you'll know, I've asked this many questions, okay, this many minutes must have passed. It just subconsciously you'll start counting these if you keep practicing.
Okay, all right. My problem is usually with the history. Just somehow I have to stop that. This history is too long, and I don't have time for the management. I know that, but I'm really trying how to minimize that.
Exactly. Try to keep your data gathering for 4 minutes max, not more than that. So if you can try, like, try to figure out when how many questions you are able to ask within that 4 minutes. That is something you can practice.
Do you suggest any kind of, like some practice that can be done to like you do in front of the mirror or something to time yourself so that I get this idea of 4 minutes and to move on already?
So have a timer. Just ask any take any scenario that you're practicing, and just keep asking questions, all the questions that you need to ask, and then see how much minutes it has passed. So you'll know, okay, let's I've asked Socrates, I've asked past medical history, P. Maftosa, I've asked ice. Now I saw time is it's only been 3 minutes. That means, okay, I still have time. I could have asked I could have asked few more questions, and then do the same thing again, practice the same questions again, but add a few more questions in between. Like that, you'll develop a internal clock slowly, like that.
Okay, okay. Practice with timer. So to make look at the timer itself, where to see where you are exactly at the point.
Exactly.
So that is
Okay.
one way. And also, in certain cases, you can identify certain key issues. So you should understand from the case, the data gathering, like which all are the issues that you have to ask, rather than dwelling on the issues that you know are, like Socrates, instead of asking all the SCORA, understand which ones will be important for you to make that diagnosis. Like in this case, number and, pain,
Pain.
that was actually enough, right?
Yeah, yeah.
And
I was just asking again more.
about UTI and all that. But I just, before we dropped off, I just wanted to tell you a few things about a minor patient who actually comes to you. So below 16, you know that this lady is a minor, right?
Yeah.
So when you understand that she is in a relationship, the first thing in management is to try to, help, try to help her confide in her parents. Because the first
Okay.
thing that GMC expects you to do is that they need to inform their parents. And if they are not, or whoever are their carers, like whoever are the guardian,
Mhm.
they're not lawfully, allowed, or, they're not legal yet, right? So whoever is the
Understood.
legal guardian, you have to try to make them inform them. And if they still refuse, then you have to understand their understanding. So that is when the Gaelic competence comes in, the Fraser criteria. See that what are the
Okay.
implications actions. Does she understand the implications of her actions, and how to protect her? Does she understand the need for using safe sex and all that, right?
So my question is, for example, in the same scenario, if the partner was like around her age, right? So would
Mhm.
during that time we will use the Gillick competency?
Yeah, I mean, you have to give her contraception, right? She's not using contraception.
No, in here in this specific case, you don't have to assess her understanding, right? We
But
don't
why
have
not?
to.
She is sexually active. I
Okay,
mean,
so
something that is not basically in, supposed to be done in her age. She you need to understand, is she capable of, being protected?
Does she know the
Does
consequences?
she know the consequences? If you explain to her the consequences, does she understand? That's the
okay.
competence that you're trying to understand
See,
from her.
you can't really stop her. You can't really stop it. She
Hmm.
has her own free will. You can't really stop her from doing anything. But all you can do is help her do it safely. That's all. You have to make sure she knows what she's doing is wrong, and she knows what can happen if she does it, and she should know what to do if something happens. Right? That's all you can help her with.
Hmm.
Okay,
And
I
another
got.
use case. So everything changes. So she
Hmm.
needs to be in hospital until child protective services comes in. So yeah, that needs to be identified, that this is actually a case where, you retain the patient. Those are one of those scenarios.
So
Yeah.
in the case if she says why I can't go home, so we have to tell that well it's because of the age difference, so we have
Yeah.
to keep it here for your own sake.
For your own
Exactly.
safety, because this is a person of power, this can turn into something really vicious. I mean, this is not something that should is lawfully allowed. This is not
Mhm.
only unethical, it's illegal, right?
And you don't really have to argue with the patient. If the patient says they want to go home, you just say that I'll talk to my senior.
And he
Yeah,
will,
that's all. Like, you
yeah.
just say I'll talk to my any.
Okay, okay.
Full, whether you know, whether you don't know whether you can do it or not, involve senior. Do not worry about involving senior. That is something is very necessary to be done for any
Okay.
case. If you don't know something, you have to involve your senior,
All
right? That
right.
is
Not
something.
to you. Yeah, because
That is
people tell sometimes you don't never involve your seniors as long as you can do it and try maximum not to involve the seniors. So it's like the brain already like as much as possible push it away.
exactly. So here you need to have a very low threshold for involving senior. That makes you a safe doctor, right? That's what they're
Yeah,
looking
yeah,
for.
yeah, yeah, yeah. I agree. I understand. I understand. All right.
All right. Anyone has any questions? Can put it in the chat, or before we start data gathering, is it necessary to ask if she comes alone as she is underage? That's not really important in this situation, because she still has her rights of privacy. She doesn't have to tell anyone. She can come by herself. That's not really an important point. Important point is, does anyone know about her relationship? That is something you can ask in the data gathering as you go along.
I hope that answers your question.
All right. So we will meet. So we'll post the next mock schedule again. All right. Thanks everyone for joining. Thank you, Dr.
Dr. Nevin.
Nevin. That was really good performance. So we will post the feedback summary in the group. You guys can go through it as well.
Thank you, everybody. Thank you for joining for another session for today.
Thanks everyone.
Thank you.